Hi, I'm Alex, a former academic foundation programme trainee in the Northern Deanery and now a clinical teaching fellow at Newcastle University. I'm going to be talking about a day in the life of an academic foundation trainee. I'm going to be talking about my experience as an AFP and go through a typical week during my academic post. The original title of the talk was A Day in the Life, but actually I think a better title would be A Week in the Life, because one of the key takeaways for me was the variety of what I got up to, and one day just wouldn't do it justice. So I'm going to talk about a week in the life instead. I'll also talk about the benefits and challenges of AFP and how to make the most out of the post. So my foundation posts look like this. I started out with academic medicine with medicine on calls, and I'll talk a little bit more about the experience of starting on an academic job. I then went on to a busy job in gastroenterology and then acute medicine, then an even busier job in hepatobiliary surgery. My AF2 year started with paediatrics, which was split into general and specialty paediatrics, and then I was due to have more surgery, but I found a swap to medicine, which is something that your deanery of choice may or may not permit. In Northern Deanery, we've got 2 academic blocks, and I was supposed to do academic medicine in my last post, but due to coronavirus, I was redeployed, so I stayed on in acute medicine and did a total of 6 months there. So my F1 academic post was characterised by a lot of variety. So firstly, I was involved in a large multinational study called PERFORM, which was looking at personalised biomarkers for sepsis. I also explored my own research question looking at clinical features of bacterial infection in immunocompromised children, and that was done at the Great North Children's Hospital. That used data from the larger study, but it was my own study which I had control of. I also had a chance to try new things, so I learned to use high-level PPE, and for someone who is more comfortable with clinical research, I even did some lab work. I also got involved in some patient-public involvement for our study, which is something that's increasingly expected in grant applications and was a really useful experience that I've taken into my own work. So what did a week look like for me during the F1 academic post? Well, on Monday I might have been working on the PERFORM study, consenting and recruiting patients, collecting blood samples, centrifuging them, freezing them for later analysis. One of the things that I hadn't really appreciated when you're working on a really large study, just how many samples you end up with, and managing those, tracking them, not losing them, was a really big task in doing this study. After that, I might have worked on some electronic case report forms that collect patient data and addressed any queries from the data management team. The next day I might have worked on my audit and prepared some medical student teaching. I also spent time working on my own independent research question, which used data from PERFORM. We also had study team meetings, more recruitment. I would go to F1 teaching during lunchtime, and then maybe I'd have some lab work for the study, and I'd deliver that teaching that I prepared earlier in the week. 1 in 4 weekends, I would have the Friday off and then work long days back of house in adult medicine. And 1 in 4 weeks, I would also work the evenings Monday to Thursday in medicine. So these on-calls kept me up to date with my clinical skills, but they also kept my hours up, so I was working 48 hours, which was on par with the rest of my colleagues. And so I was actually bringing in the same amount of money as a lot of them were. So due to COVID, I was redeployed from my academic post and I carried on in acute medicine. And this was actually quite nice because many of the other jobs that I've been working in have been quite short, and for the first time I really felt part of the team. Especially COVID brought together the acute medicine team, and the consultants were really thankful for us being there. However, even during redeployment, there were opportunities to get involved in other things, and that was all made easier by the skills that you develop as an AFP. Because I had experience in clinical research studies and good clinical practice training and advanced life support, I was able to be released from clinical work to work as a co-investigator on the Chaddock's NIHR COVID vaccine trial. So I recruited and consented patients and got them ready to have the new investigational vaccination for COVID. I also got involved in the running of simulation teaching for our new incoming F1s. Also, your F2 post is generally when things you've worked on start to come together, and between my F1 and F2 posts I managed to have a poster presented at an international meeting. I got some education work presented locally, completed 2 cycles of an audit, published a case report, and there's 2 more research manuscripts in progress from all of that as well. So even missing one of the academic jobs, I was still able to get a lot of good outputs from my CV. The AFP does come with some challenges, and those are really important to recognise and reflect before you apply and during your post. I had my academic job first, which was a little daunting as I've had no experience doing a ward job, but had on calls, weekends and evenings, and arguably during those you've got a bit less support. Somebody with limited experience, even doing basic procedures like cannulation, and less confidence overall, you're kind of getting thrown in the deep end a little bit doing that. Academic work can also be a little bit different to clinical work. So when I was doing my hepatobiliary surgery job as an F1, I was personally looking after about 25 quite sick patients across several wards with quite limited support, and would often get maybe 50 calls a day chasing up tasks, sometimes multiple calls about the same thing, and I was often juggling several things at once. So while that was challenging in its own way, equally on my academic post, I was often left to decide what I should be doing for long periods, and it can be quite hard to know what to do next, and some people might find it difficult to motivate themselves in those circumstances. AFPs generally have less clinical time than everyone else as well. Depending on the region, you might have 4 or even 8 fewer months in full-time clinical practice, which is the case in Northern Deanery, and so you'll need to work that bit harder to feel as confident as the rest of your peers. There's also fewer opportunities to engage with your portfolio during your academic post, and so overall you need to complete your portfolio in less time. This really creeps up quickly because you have to submit your completed portfolio early on in the last job of the year, meaning that you have to work hard in your clinical posts to keep up. My second post was a busy general and acute medicine post, which did get me back up to speed clinically quite quickly. However, a lot of the data that I needed to work on my own research question wasn't ready until after I'd finished that first academic post. This meant that to progress my work, I had to do some work during another post, which fell during the medicine post. But it can be difficult to find time to do this. So this is an example of my acute medicine rota. So it was all 12.5-hour shifts, 50% nights, and 1 and 2 weekends. So you were equally spending time between doing nights, recovering from nights, doing long days, or you had a small amount of time off. For anyone who's done research alongside being a student, it's not quite the same doing it alongside a full-time job. You're learning a lot of new things, the job can at times be stressful, the hours are long, you're working 48 hours a week, so when you come home you don't necessarily want to work on research, so you really need to be careful to look after yourself. Your AFP might give you really exciting opportunities to do independent research, contribute to larger projects, and also get opportunities to teach, get involved in quality improvement, and just develop yourself generally outside of clinical work. And you should absolutely pick things that interest you and try them. But part of making the most out of the post is, and that is both the academic component of the post and the clinical component, is that you will be plenty busy on your clinical jobs, and you need to look after yourself and take the time to explore what it's like working in a different way, working in the way that academics do. You need to think about when to say no to things. Often the type of people who do AFP say yes to lots of different opportunities, but you can't say yes to everything and still do a good job of everything. This can be a bit of a balancing act between what you promise and what you deliver, and it's important to manage expectations. I think it's a really important part of your self-growth as an academic clinician to recognise what you're able to achieve, how much time you have, and what you're able to deliver. Amongst all of the opportunities that you've got available to you, remember that you are a doctor first above everything else. You need to keep on top of your clinical and portfolio commitments, and this will reduce your stress in the long run. Don't worry too much about your clinical competence overall. Part of the selection for AFP is for people who the selectors think will be able to juggle these different commitments, and you will be as competent as your peers after a couple of jobs. Remember your portfolio and start working on it quite early. It's absolutely essential to make sure that you take the portfolio seriously and work on it from the beginning, try and find any opportunities that come up to try and work towards it, and that'll help you avoid stress at the end of the year. So what are my takeaways from all this? So AFP is great. I can't speak for other deaneries, but my AFP programme in Northern Deanery and with my supervisor, there was the flexibility to get involved in lots of things within and also not directly linked to your research. It allows you to pursue something that interests you and to develop new skills. Academic work's quite different to working on the ward. That can be a relief, but it can also be quite challenging in its own way. Remember that despite all the opportunities that will be available to you, you need to manage expectations and know when to say no to things. Respect your portfolio as well, because it can cause you a lot of stress if you don't. Above all, everything else, you're a doctor first, and the priority for your foundation programme is to develop the skills you'll use as a doctor for the rest of your career. Finally, I'd say that if my experience sounds good to you, the level of variety and the chance to explore something that really interests you in much more detail, then I'd say go for it, and I'm pretty sure you're going to really enjoy it.
Hi, so my name's Zaid. I am an F1 in West London, and I just completed the Medics Academy Training in Teaching Day 3 course.
I think it's structured in a really nice way with a lot of resources you can permanently access. The course isn't over after 3 days. You've got a ton of online content that you can always revisit, and I think that is fantastic.
I thought it was a great way to learn through having a full day at the start and then 2 later days of self-study. It really allowed for flexibility and allowed us to fully engage in the course.
It also made me feel better prepared to deliver teaching remotely or digitally.
It's really interactive. There's a lot of small group feedback session, exchanging ideas and learning people's perspective.
After actually doing this course, I realised that teaching is more of a science, and it's really important to get clear feedback so that you can improve your teaching.
This course also encouraged me to think thoroughly about what my audience actually wants from my teaching session, and also how I can keep them better engaged.
Really great and fantastic to get such fantastic lectures from experts in the field throughout the 3 days.
It was also interesting to learn from others taking part on the course because we all have different levels of experience, so it was interesting to gain their perspective on things too.
I learned not just about different style of teaching, I also learned about what is medical education, how to build a career in medical education.
Overall, I learned a lot from the teaching course.
I think it's a really well done course.
I really enjoyed it.
And I really found it very enjoyable.
That's what I thought of the whole course, and I really enjoyed it, and I would recommend it to other people.
So thank you for letting me participate.